The Twinrix Vial vaccine is used to help prevent infection from the hepatitis A and B viruses. Hepatitis A infection can range from mild to severe, and hepatitis B infection can lead to serious problems including liver failure and liver cancer. This combination vaccine is made from whole, killed hepatitis A virus and a genetically engineered piece of hepatitis B virus. It helps the body produce immunity to prevent infection from hepatitis A and B. It does not protect from other virus infections. The vaccine is recommended for people at an increased risk of getting these infections, such as healthcare personnel, lab workers, police, fire and emergency medical personnel, hemophiliacs, dialysis patients, people with multiple sex partners, men who have sex with men, and injection drug abusers. The recommended dosage and optimal timing for taking this vaccine should be discussed with a healthcare professional. Before receiving the Twinrix Vial vaccine, it's important to read all vaccine information available from your healthcare professional. This vaccine is typically given by injection into a muscle, usually in the upper arm for adults and children, and in the upper thigh for infants. The vaccine is given in a series of 3 injections over 6 months, and it's crucial to follow the vaccination schedule closely for the best effectiveness. If you have a fever or illness at the time of a scheduled vaccination, your healthcare professional may choose to delay the injection until you are better. The dosage of Twinrix Vial is based on your age, and different brands of the hepatitis A/hepatitis B vaccine are available for different ages and may be given differently. If you cannot get the vaccine before traveling or for whom the vaccine might not work, your healthcare professional may also give an injection of immune globulin, which contains antibodies against the viruses and will immediately help protect you from developing an infection. However, these antibodies only last a few months, so it's important to carefully follow your vaccination schedule for proper protection. Some common side effects of Twinrix Vial include pain, redness, and swelling at the injection site, fever, tiredness, headache, nausea, and diarrhea. If these effects persist or worsen, it is important to inform your healthcare professional. Rarely, some people may experience symptoms such as fainting, dizziness, vision changes, or ringing in the ears after receiving the vaccine injection. If you experience any of these symptoms, it's important to notify your healthcare professional right away. Sitting or lying down may help alleviate these symptoms as they usually do not last long. It's important to remember that this medication has been prescribed because your healthcare professional has determined that the benefit to you outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects. Although very rare, a serious allergic reaction to Twinrix Vial can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your healthcare professional if you notice any other effects not listed above. If you have concerns about side effects, you can also report them to the appropriate authority in your country. In the US, you may report side effects to the Vaccine Adverse Event Reporting System, VAERS, at 1-800-822-7967, and in Canada, you may call the Vaccine Safety Section at Public Health Agency of Canada at 1-866-844-0018. Before taking Twinrix Vial, make sure to inform your healthcare provider if you have any allergies to vaccines or any of the inactive ingredients in the product. It is important to discuss your medical history, especially if you are currently ill with a fever. If you are a hemodialysis patient, the vaccine may not be as effective for you, and you may need to have your hepatitis A or B antibody levels checked yearly. People with immune system disorders, such as HIV infection or certain cancers, may not produce enough antibodies to protect against hepatitis A or B. Your healthcare provider may need to check your antibody levels after the vaccine series. Older adults may not produce as many antibodies to the vaccine, so it's important to talk to your healthcare provider about the details. If you are pregnant, Twinrix Vial should only be used if clearly needed, so discuss the risks and benefits with your healthcare provider. It is also unknown if this vaccine passes into breast milk, so consult your healthcare provider before breastfeeding. It's important to be aware of any potential drug interactions that may occur with Twinrix Vial. This can affect how well your medications work and may increase the risk of serious side effects. You should keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your healthcare professional. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this vaccine include drugs that weaken the immune system, such as cyclosporin, tacrolimus, cancer chemotherapy, and corticosteroids like prednisone. It's important to note that while other vaccines may be given at the same time as the hepatitis A/hepatitis B vaccine, they should be administered with separate syringes and at different injection sites. This is to ensure the effectiveness of each vaccine. Be sure to discuss any concerns or questions with your healthcare provider. Today, we'll be discussing Twinrix Vial, a vaccine used to help prevent hepatitis A and B. This vaccine is used in both children and adults to protect against these two types of hepatitis. It is usually given as a series of injections over a period of time. The exact schedule will be determined by your healthcare provider. It is important to receive all recommended doses to ensure maximum protection against hepatitis A and B. Talk to your healthcare provider about the best time to receive this vaccine and any concerns you may have about its use. Remember, like all vaccines, Twinrix Vial may not fully protect everyone who receives it. Your doctor may perform lab or medical tests, such as checking hepatitis A or B antibody levels, while you are using this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. Make sure to keep records of the vaccines for yourself and your children. When your children are grown, provide their records to them and their healthcare professionals to prevent unnecessary revaccinations. The recommended dosage and schedule for Twinrix Vial is typically a series of 3 injections given over a 6-month period. Your doctor will determine the best timing for you to receive each dose. Remember, it's important to follow your doctor's instructions carefully for the best protection against hepatitis A and B. Remember, it is important to receive each dose of Twinrix Vial as scheduled. Be sure to ask your healthcare provider when each dose should be received and make a note on a calendar to help you remember. This will ensure that you receive the full benefit of the vaccination. It's important to store Twinrix Vial in the refrigerator, but make sure not to freeze it. And as with all medications, keep it out of reach of children and pets. When it comes to disposing of Twinrix Vial, don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Remember, it's important to handle medications responsibly to ensure the safety of your household and the environment. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.